Wes Streeting, I think people want to know that you do actually have a plan for the NHS. You fought the election on a promise to inject just over £1 billion into the NHS, and next week at the budget we're expecting a substantial uplift, more than anyone else, maybe 5, 10, 15 billion pounds. What's changed in 3 or 4 months?
So we're not wasting any time in tackling the NHS crisis. In the first 3 months of a Labour government, we took action within weeks to end the junior doctor strikes, which was costing billions and seeing well over 1 million appointments and operations delayed, cancelled. That's been settled now. Ways of working.
Sorry,
so we're getting
just,
going.
But my question is, you thought just 4 months ago £1 billion would be enough. That's what you told the public. What's changed?
Well, hang on a second, Sam. We got quite a lot of flack ahead of the election from people saying, hang on a minute, this manifesto doesn't have enough promises and you're not committing to spending enough. One of the reasons we were so disciplined about the manifesto is we knew we were walking into a big challenge. Beyond that, we've also come in with a very clear reform agenda, and that's what we're starting a national conversation about today.
I'm just struggling to match what you were saying before the election with kind of your plan now with money and reform that's going to be put in from the spring. A year ago, you said there is no route out of the crisis in the NHS that simply requires spending more money.
That's right.
You talk a lot, as you have done today, about moving treatments to the community. But where in the community? Treatments done by whom? Paid for by whom? What happens to the hospitals that have to do less? You know, that's all for the spring. You're getting this money now. This is money without reform.
Well, let me give you an example of how investment in the budget, which, by the way, you know, that comes in the new fiscal year in April, so that is spring. In terms of how we replan care, neighbourhood health services, shifting care out of hospital into the community, I suppose you could say, well, you should just come in and impose your view of change. I just say to people, be careful what you wish for. The last time a new health secretary came in after a general election where their party won power, that was Andrew Lansley, the Conservatives, after 2010, who came down with a massive top-down reorganisation that nobody voted for, nobody wanted, cost billions and set the NHS up to fail. So I make no apology, actually. In fact, I think it is a good thing when you have a government that comes in with a very clear reform plan but says we're going to involve people in it.
You yourself have said that you've got to fix social care to fix the NHS, to free up more beds. Does the money that you're expecting from the Chancellor next week include the cost of fixing social care?
So we're not going to fix the crisis in the NHS and social care overnight or even in a single budget, but what we are doing is starting straight away on social care. Today in Parliament we are legislating for the first ever fair pay agreements in social care, so we can recruit and retain the vital care staff, the care professionals that we need to provide
social
great care.
Could mean more spending on the NHS. It could cost people more taxes and more spending to fix social care, because that's not part of the next
I'm really
budget.
clear that unless we address the crisis in social care, which is important in and of itself, by the way, for older people and disabled people, we won't fix the crisis in the NHS.
But next week's budget settlement doesn't do that.
Which is why myself and the Deputy Prime Minister are working closely together. I don't want to preempt what the Chancellor will say in her budget, but I can tell people that not only are we taking immediate action on social care, I'm determined that alongside our plan for health will be a 10-year plan for social care, and I actually want to work not just with care users and people who work in social care. I actually want to involve other political parties in that process, because frankly all of us have got blame to share because successive governments have failed on social care. I think if we can work together to put it right, I think we're doing the country a great service.